So thumb range of motion can be complicated because really the motion is occurring at the carpal metacarpal joint, which is located near the anatomical snuff box. Remember, the scaphoid lies in this region, and so truly the carpal metacarpal, which is a saddle joint, is just distal to there. It does not occur at the first MCP or IP joint. So truly our axis of rotation is located at the wrist for these motions. So the first one we're going to do is thumb flexion, and this is considered the neutral position for the thumb. And so thumb flexion actually is this motion right here. And what we're going to use is that the fulcrum or the axis is going to be over the palmar aspect of that first carpal metacarpal joint. The proximal arm is going to be the ventral midline of the radius in this case. You notice we're not in the midline of the forearm, we are along the midline of the radius with the axis over the CMC joint, and our distal arm is going to go with the ventral middle of the first metacarpal, which is here. So we're not going to follow these joints here, we're going to follow this joint. The other thing that's unusual about this particular measurement is that we're not starting at 0. So for the first time, we're not starting at 0, or we're not starting in that 90 degrees. We actually are starting at a different number. In this case, we're at 15 to start with, because that's the approximate position of the thumb in a neutral position. So we have to remember this because we're going to have to subtract our end number from our starting number. So we're going to ask the patient to go ahead and bring the thumb across. And again, remember, we're lining up with that first metacarpal, reassess the position of my landmarks here, and the patient has gone from a 15 degrees to 5 degrees on the other side, which means she has 20 degrees of motion. So we're going to come and we're going to do passive as well, which gains us another 6 degrees. And then remember, stabilize proximally, move distally, and our end feel is going to be soft in this case, typically because of the soft tissue approximation in the hand. Thumb extension is also measured in this position, and in this case now the thumb carpal metacarpal joint is going to move out in this direction. I apologize, normal range of motion for thumb flexion is 15 degrees. We're going to use the same landmarks with the carpal metacarpal joint, the midline of the radius, and the first metacarpal, and we're going to note the starting position. And we've got 20 degrees, and we're going to ask the patient to move the thumb out. Our end position is 50 degrees, which shows us 30 degrees of range of motion. I'm really not going to get a whole lot of passive motion here, maybe a couple extra degrees. And then I'm going to come in, stabilize, and get my end feel, which in this case is a firm end feel. For thumb abduction, we're going to put the hand or the wrist or the forearm in a neutral position at this particular case, because the movement for abduction is to have the thumb move away from the hand in this position. So this is considered thumb abduction. And we're going to have the same type of the landmarks again. So our fulcrum is still going to be over that CMC joint, and we're going to have our proximal arm along the midline of the radius, and we're going to use the first MC as our distal arm. We're also starting out at 8 degrees of position here, so we need to note that measurement, and we're going to ask the patient to move the thumb away from the hand. And we're going to line up again with that first MC joint. And we've got 35 and subtract that 8 to begin with at 27. And we're going to do a little bit more passive, and we can get her up quite a bit further. And then again, we have to grab that first metacarpal here to make sure that I'm truly getting my end feel at the CMC joint, and we have a firm end feel. Normal range of motion for flexion is 15, normal for extension is 20, and for abduction is listed as 70 degrees. For the MCP and the interphalangeal joints throughout the thumb and the fingers, typically we can start using the special finger goniometer, or we definitely need a goniometer with the haft so that we can lie it against the skin. We can, sometimes I've seen people take these and cut them off so that they're a little bit smaller here and a little bit easier to fit on the hand. When you're performing MCP, flexion, and extension, so for flexion, you can put the goniometer on top of the finger, and you're going to ask the patient to bend down as far as they can, and you're just going to lie the goniometer along the top like here, and we have 100 degrees of flexion. And when we can do passive, and then come in and do your end feel, which for the most part these end fields are all going to be firm or hard. Now to do extension of the MCPs, obviously if we have this type of goniometer, it does not allow us to extend, or if we do it in this one, you can see this comes out here. And so what you do is you put the goniometer on the bottom side or the palmar side of the hand, and now ask the patient to extend their fingers, and you're going to place the goniometer up in this position here. So we're at the bottom of the hand, even though we're measuring MCP extension in this position. And we have 25 degrees of extension. I can do my passive range of motion and measure that, and now we're up to above 30. And then there's my end feel, which is a firm end feel. For the interphalangeal joints, you're going to do the exact same thing in terms of measuring. So you're going to ask the patient to come all the way down as far as they can, and just lie that along the top there. Do your active, passive, and end feel. If you're using this type of goniometer, you can do the same thing here to get your measurement, active, passive, and end feel. For extension, you'd have to put this goniometer on the bottom side. And she does have a little bit of extension here, even though you're not supposed to have that, for the PIP joints. The MCP, metacarpal phalangeal joint for the thumb, you're going to measure again the exact same way. Okay. Getting in this position using the goniometer, as well as the IP joint, and then you can come on the inside of the hand here and ask the patient to extend up and to get the goniometer to lie flat against the hand in this position. Our normal ranges of motion, so for the thumb MCP for flexion is 50 degrees, and extension is 40 degrees with a firm to hard end feel. The thumb IP joint, 80 degrees of flexion to 20 degrees of extension with a firm end feel. The MCP, metacarpal phalangeal joints, are 90 degrees of flexion and 20 degrees of extension. The PIP joints, and these are for all the fingers, these are for all the digits. The PIP joints, flexion is 100 degrees for coming down. Extension should be 0. For the PIPs, flexion is 70 to 90, and extension is 0. And to get the distal IP joints, you may have to stabilize a little bit closer and then ask the patient to flex down so that you don't end up, if they bring their finger all the way down here, you can do that. Sometimes it may be a little more difficult to measure.